Blunt end, the triangle essentially is an organization from the tippy top, which is the blunt end, to the sharp end, which are the people doing the closest to the core work of the organization. So we talk about the blunt end. It used to be, for safety reasons, we used to talk about the sharp end used to be where the errors would happen, and all the focus was right there. Without us understanding, because that's very linear, right? Oh, happen there, right there, take care of it right there, linear. So the blunt end is the very tippy top. So you could say the board of directors, the administrative team, all people who we now realize, because we understand complex adaptive systems, and if you pull a little something here, it will have an effect here, we realize make decisions that absolutely will impact down here at the sharp end. And an example I use is like there are hospitals around the country who are, for consumer satisfaction, asking staff to provide the service of letting patients eat, even in the acute care areas, when they want. Well, here's an example of pulling a little something here and not understanding what it does at the sharp end. Complex adaptive system concept. So they make the decision, even on a unit that is full of patients who have diabetes, that they're going to let them eat when they want. Well, nursing work has some routine issues about it, right? So nurses always are trying to stay on course. So they develop certain routines. And one of the routines they should be able to count on is, our breakfasts on this unit come at 8:15. We have diabetics. Therefore, we know we can get their glucose reading, give them insulin at a certain time, and in 30 minutes their breakfast will show up. And they need that kind of routine because so much else can be unpredictable. All of a sudden, a decision made with great intent, let's make our customers happier, let's let them eat when they want. You've got nurses all of a sudden, one care focus, because there's many other things they do besides glucose, insulin, and deliver trays or help people eat. One specifically care focus you've taken from a predictable course and routine way of managing it to maybe a 2 or 3 hour period when you're not sure when you're going to need to do the glucose, when you're going to need to give people's insulin, or when they're going to be able to eat. Huge but perfect example of something happening here, not understanding the ramifications, but a huge impact at the sharp end. So that's the blunt end and sharp end.